And I'm Caitlin.
I'm Debbie.
I'm Breton.
And I'm Mac, your host. We're talking about aromatherapy. First, we'll talk about the expanded healthcare model, and then we'll talk about aromatherapy and the implications behind it. First off, Breton, start us off.
Okay, so I will be talking about the expanded healthcare model, which we call the holistic health model, just represented behind me. A model is a pictorial representation that shows the interrelationships of important concepts. When creating a model, it is important to consider the meaning of the model, how easy it is to articulate, and is it a good guide for decision making. As more people's attitudes and beliefs are changing, this gives rise to a new perspective on health. Healthcare professionals and patients are starting to shift from disease-centered to person-focused approaches in health. This shift in values is why a new, innovative healthcare model needs to be adapted. Our group has constructed the holistic health model to be used as a prototype for enhancing individuals' well-being and serve as a model for healthcare. At the premise of this innovative model is the relationship between the healthcare professional and the patient. This relationship is important because as we shift from a collaborative patient relationship to a new partnership, the two are seen as equal participants in the relationship. The professional as well as the patient brings their own knowledge, skills, and beliefs to the respectable partnership. Within a holistic approach in mind, the healthcare professional presents options for healing from non-invasive to invasive. They respect the patient's own self-healing abilities and they assist the patient to find meaning in life and illness experiences. The patient fundamentally is an active participant in promoting holistic health through self-care, health promotion, and illness prevention. They desire a partnership based on equity and respect and utilize the resources from the healthcare professional or on their own to make the best decision possible. When the healthcare professional and patient create this partnership, they both bring their own knowledge, skills, and beliefs to help heal the client from within. Keeping the levels of healing in mind, the partnership can start on level 1 with diet, exercise, and detoxification. There are so many resources available that can assist the client to heal and aid in health promotion. Starting with non-invasive to invasive strategies, the healthcare professionals can present options based on integrated therapies to the patient that can aid in the other 4 levels of healing. True healing involves participants on all 5 levels. Since the first level of healing involves the physical body, if non-invasive therapies do not work, then conventional medicine or allopathic medicine is also available to the patient. This is represented in the model as integrated therapies at the top and conventional medicine at the bottom. They are also represented in this way as the levels of healing transition from body, mind, and spirit. Keeping the context of primary healthcare in mind, the healthcare professionals are there to help the patient, promote their own health, and offer resources or different options to help the individual heal from within. Because this is a holistic healthcare model, it would not be effective if we did not keep the determinants of health unique to each individual in mind. The determinants of health are printed larger in the model because it has a huge impact on whether or not the client accesses primary healthcare, creates a partnership with a healthcare professional, and seeks out integrative therapies or conventional medicine. Socioeconomic status, education, and culture are the preliminary determinants of health that prevent or empower an individual to think outside of the box and use alternative medicine within the healthcare system to promote holistic health healing. This model is representative of a change in healthcare ideology and promotes a greater focus on a partnership framework to create holistic health for the individual.
Thank you so much, Breton. That was very insightful.
Yeah.
Up next, we have Debbie. She's doing the underlying assumptions.
I will be talking about the underlying energetic assumptions of our model. As we all know, humans are both complex and unique in their needs of healing. Our model includes healing through body, mind, and spirit with the help from healers, in our case, healthcare professionals, by the use of transfer of energy and harmonization, enabling humans to heal and adapt to their health needs. Within this model, an energetic assumption discussed in the module indicates human beings are open, complex energy systems rooted in the internal and external environment, co-evolving by interaction and mutuality, meaning humans are influenced by many internal and external factors, such as other humans, feelings, mood, thoughts, and external environment. Within the first level of healing of our model, the physical body is essentially the start of a person's healing journey. Through physical touch, there's a transfer of life energy through organisms. As well as a transfer of energy, there's also a change in energy pattern when healing occurs. This change in energy pattern helps restore a balanced environment for the person. Moving forward from healing the physical body, the next step of healing in our model is the mind. The healing of the mind is important because there's a strong correlation between high and low mindfulness to a person's health improvement. There's also the combination of emotional, cognitive, and psychosocial factors that have been shown to significantly affect health outcomes. In the Encyclopedia of Complementary Health Practice, they indicate that organs in our bodies can extend energetic rhythms as far as 1 to 6 inches from our body, while emotions have the ability to be projected 10 to 15 feet from our bodies. While there is a partnership between client and healthcare professionals in our model, the client is always at the center of the health model, and the healer's ability to heal depends mostly on the patient's willingness and desire to heal. As with the assumption that humans are able to heal if there's an innate desire, the flow of energy is enhanced due to the healer's or patient's desire to heal. Following the healing of the mind, we move on to healing the spirit. As noted in our module, humans are capable of change, transformation, and transcendence. Healing is an internal movement towards harmony and order that occurs in living organisms. There's change due to the infinite energy radiating from our bodies, enabling us to adapt. Therefore, the transfer of energy between a patient and the healthcare professional is essential for healing.
Awesome, thank you, Devi. Up next, we have Erica introducing us with aromatherapy.
Okay, so I'll be introducing you to our chosen therapy of aromatherapy. Aromatherapy is becoming an increasingly popular form of alternative medicine in our society today. Aromatherapy dates back to 19,000 years, and it began its practice in ancient Egypt, China, the Far East, India, and Renaissance Europe. Aromatherapy is known as the treatment of scents by means of essential oils from plants, blossoms, roots, and leaves, and is used most commonly with massage, baths, inhalation, and diffusion. Current research suggests that aromatherapy improves mental and physical health and quality of life, and also has antibacterial benefits that can fight hospital bugs and ranges from short to long-term effects.
Fun fact, around the time of World War II, healthcare professionals used essential oils to fight bacterial chest, wound, and urinary infections.
The uses of essential and base oils in massage and bathing work toward therapeutic and relaxation benefits with the use of oils such as sweet almond, grapeseed, and apricot oils. Inhalation and diffusion of oils focus on improving the patient's atmosphere and can relieve sinus congestion, insomnia, and clogged pores. Speaking to physiology, essential oils and aromatherapy have many positive effects on the body. When inhaled, essential oil scents travel through the olfactory bulbs to the limbic system, which controls emotions and feelings, and then to areas of the brain associated with memories. These can also stimulate the production of hormones that further improve mood and emotions. Diluted oils applied topically can soothe irritated skin, calm sore and spasming muscles,
or even treat mosquito bites.
Incorporating our holistic health model using aromatherapy involves the patient, acute healthcare professionals, community healthcare professionals, naturopathic medicine doctors, and so on. When a patient inquires about alternative health therapies, it is important for all healthcare professionals to have some knowledge and understanding of complementary alternative therapies that are available to the patient and those which would be beneficial in health promotion. With this knowledge, all healthcare providers will know who and where to refer patients to in the community, such as naturopathic doctors and clients. This example relates to our model as we move toward a partnership approach with the patients and other alternative medicine professionals. Our model integrates therapies to promote patient healing on all 5 levels of healing. Speaking to these levels of healing, we believe that aromatherapy can be integrated on each level because it touches on the body, mind, and spirit. Beginning at level 1, the foundation of healing, aromatherapy can affect the physical body by boosting and strengthening the immune system and refreshing and cleansing the environment. Level 2 involves the energetic and emotional body. Emotions can be calmed or enhanced by the use of inhaling or diffusing these essential oils. Level 3, the mental field, relates to aromatherapy because essential oils can have a major impact on a patient's mental health status, such as mood and anxiety. Level 4 and 5 speak to spiritual healing, which aromatherapy plays a large part in many spiritual healing practices, using specific scents to heighten the healing practice.
Awesome, thank you so much, Ayoka. Up next, we have Caitlin.
I'll be talking about the determinants of health that relate to aromatherapy. So we've been taught through and through during our entire program about the determinants of health. It has been ingrained into all of our brains what they are, how important they are, and why we need to consider each aspect. Now that we have completed many clinical hours and seen these determinants in practice, we're able to broaden our minds to alternative therapies. Therefore, aromatherapy will be discussed relating to 5 determinants of health. Considering aromatherapy can be linked to any determinant of health, socioeconomic status and education will not be a main focus in this project. Since these 2 determinants of health have clear relevance to aromatherapy, considering a patient needs to be educated on a topic before he or she will use a specific therapy, and he or she needs to be in a financial position to afford a therapy not covered by traditional healthcare coverage. Due to this, I will only briefly touch on these as we've decided to cover the less obvious determinants of health for the sake of educating our viewers. The 5 determinants of health that we found to be impacted by aromatherapy are personal health practices and coping skills, culture, health services, healthy childhood development, and gender. To start, personal health practices and coping skills are a major determinant of health impacted. People all over the world are using aromatherapy for anxiety, depression, mood changes, and among many other things. Using aromatherapy as a coping skill related to any form of anxiety, whether it is chronic, acute, post-traumatic stress disorder, etc., has been helpful for many people. Scent has a direct path to the brain, so any aroma works within a matter of minutes. This is a huge relief to those that suffer from anxiety, as a huge concern with these clients is the time it takes for a long-term medication to begin to work. As healthcare workers, this is a huge step for us as we are able to see how the client reacts to the scent before they, or even we, can leave after our assessment. Aromatherapy has also been proven to be useful in managing pain from many forms, such as chronic back pain or even labor pains. The most powerful thing about aromatherapy and coping skills, however, is the fact that so many scents can be combined to tailor to the individual's needs and likes. This increases compliance rates, decreases negative side effects, and can lead to an overall sense of well-being. Second, aromatherapy has the ability to bring people from the same or different cultures together. For example, ancient Chinese cultures used aromatherapy for harmony and well-being. Greek and Roman cultures often use specific aromas as perfume. These have now spread across the world and are primarily used in North America and Europe for their therapeutic properties. When cultural differences are accepted and valued, cultures are brought together. This works when discussing aromatherapy. When healthcare settings are accepting of aromatherapy that a culture may strongly advocate for, the staff are enlightened on the alternative therapies used by others. This also allows the culture to thrive in their own environment, which is vital for a healing environment. Third, using alternative therapies such as aromatherapy can increase access to health services. There are doctors, nurses, and many other healthcare professionals that specialize in aromatherapy, often called an aromatherapist. Having more specialists means increasing access for patients, which is a major concern in Canadian healthcare today. By opening a patient's mind to alternative therapies, these patients may be seen faster than a typical doctor. They may have increased tools in their tool belt to manage their concerns, such as anxiety, depression, and pain, as mentioned above. By doing so, patients may have less doctor visits, yet more access to different types of medical assistance. If a patient has lots of different options for their care, he or she will also become more of a partner in care. Increased doing with instead of doing for, as well as creating more access for patients to receive the care he or she wants, will lead to an overall higher sense of well-being. Fourth, healthy childhood development could be greatly impacted by aromatherapy. Many parents today are looking for chemical-free ways to improve their child's health. Certain aromatic plants, such as tea tree and lavender, offer antibacterial and antiviral properties. By providing parents with a natural option for their child's health, we are likely to see a decrease in the number of childhood illnesses such as colds, flus, and many more. This will allow the child more healthy time to develop and let their bodies focus on growing instead of curing. There is also no known allergic reaction to aromatic oils to date. This is a fantastic tool given that allergies are now becoming a very common issue in childhood. Scents can be added to stuffed animals, which allow the child to carry the scent with them anywhere he or she goes. One animal can be for school, for concentration, another for time outs, so for calming, and another for bedtime to promote sleep, as well as so many more. This gives parents, teachers, caregivers, and anyone else that is spending time with the child the ability to control the child's mood swings, allowing the child to continue normally in school, sleep, and therefore is exposed to an alternative therapy throughout his or her entire life. The child will be educated from an early age. This is easier for the child to incorporate this therapy into later life, therefore decreasing the need for education as an adult. Again, if a child is used to a specific lifestyle, such as the daily use of aromatherapy, socioeconomic status will not become a huge factor in adult life. The child will understand from an early age how to afford essential oils and how to continue to work with them into a tight budget. This will allow the child to continue to use this alternative therapy throughout life without making a giant lifestyle change in adulthood. Lastly, gender has an influence on the use and effectiveness of aromatherapy. Gender is much more than if you are male or female. As described by the Public Health Agency of Canada, gender also refers to the array of societal determined roles, behaviors, power, and influence that society ascribes to a differential basis. The public has seen aromatherapy as a woman's treatment, although men also benefit from the same treatments. There are many woody, earthy, and spicy scents that create benefits for both men and women, although men tend to appreciate these scents more. Just like women, and as described above, the scent is personalized to the man and used for the purpose that works for the individual. Men can also fight pain, depression, stress, infection, among so many other concerns in the same way that women do. Society has led our generation to believe that this may be a more feminine practice, that men were the first to start using aromatherapy. Although the influence is there that it is not masculine to use aromatherapy, the benefit should outweigh this influence. If we, as a healthcare team, begin to accept and use alternative therapies with our clients, practice such as aromatherapy may be very different for men than it is today. To sum everything up, personal health practices and coping skills, culture, health services, healthy childhood development, and gender can all be influenced by aromatherapy. Although it is not a traditional treatment in society today, it can be a very influential one. From killing bacteria to fighting depression, aromatherapy can positively impact each and every woman or man's life. We are lucky to have alternative options and very lucky to have easy access to the tools needed to begin a wellness journey with aromatherapy.
Thank you, Caitlin. That was some very useful information. In conclusion, we can see how aromatherapy plays into our holistic healthcare model because the healthcare professional and the patient can use this to promote healing on all 5 levels. With a collaborative approach from allopathic medicine and integrative therapies, we can help promote health, healing, and an overall sense of well-being from a more holistic point of view.
Thank you.
Thank you.
Thanks.
Thanks.
I'll be introducing the expanded healthcare model, which we call the holistic healthcare model. A model is a pictorial.
And also has antibacterial benefits. And also has antibacterial benefits that can fight hospital bugs and ranges from short to long-term effects.
Fun fact!
Emotions and feelings, and then to areas of the brain associated with memories. We're filming, Caitlin!
It has been noted that humans are both complex and unique in their needs.
Erica, we're trying to film.